Have you recently quit smoking and found yourself feeling surprisingly unwell? Welcome to our exploration of smoker's flu, a misleading term for symptoms you may experience when you quit smoking. Join us as we demystify this phenomenon and guide you toward a healthier, smoke-free life. Let's discuss smoker's flu, delving into its causes, symptoms, treatments, and recovery process. If you're navigating the choppy waters of quitting smoking, this video is your compass to healthier shores. Smoker's flu is a non-medical term that describes the range of symptoms people experience after quitting smoking. It's a normal reaction to the body missing nicotine and other chemicals it was used to. The root cause of these symptoms is nicotine withdrawal. Nicotine is a powerful chemical that affects your brain and body. When you stop smoking, your body must adjust to its absence, leading to physical and psychological symptoms. Smoker's flu can present with difficulty sleeping, poor concentration, irritability, headaches, tiredness, dizziness, dry mouth, and cough. Other symptoms include chest tightness, stomach pain, constipation, postnatal drip, sore throat, and cravings. As you know, cravings can be pretty intense when you stop smoking, and this can make the process of quitting more difficult. The symptoms of smoker's flu vary in intensity, but are all signs of your body cleansing and readjusting after quitting smoking. These symptoms, though uncomfortable, are manageable. Key strategies include staying hydrated, maintaining a healthy diet, engaging in physical activity, and possibly using nicotine replacement therapies. Everyone's recovery journey is unique. Generally, symptoms can last about a week or more. Note that the physical symptoms of nicotine withdrawal are self-limiting. This means they go away in about a week, and you may not need any specific treatments. However, you can do a few things to make the discomfort easier. Managing stress and cravings is a pivotal part of recovery. Techniques like meditation, yoga, and joining support groups can be incredibly beneficial. It's about finding what works for you. You may consider nicotine replacement therapy, whether this is the nicotine patch, gum, lozenges, or other forms. They can deliver small quantities of nicotine to your body to ease the withdrawal symptoms. Over-the-counter medications can also help relieve pain, constipation, runny nose, difficulty sleeping, and other symptoms you may experience. Exercising, getting adequate sleep, breathing exercises, keeping busy, and getting involved in a new hobby can also help you feel better faster. Overcoming smoker's flu brings significant long-term health benefits. Improved lung function, reduced risk of heart disease, and a general sense of well-being are just a few rewards awaiting you on this journey. Embarking on a smoke-free life is challenging, yet deeply rewarding. Understanding and overcoming smoker's flu is crucial in this journey. Embrace the change. Your body is healing and adjusting to a healthier you. Remember to subscribe for more insightful videos on smoking cessation. Share your quitting journey and tips in the comments. Let's inspire and support each other towards a healthier, smoke-free future.